Good day everyone! Today I'm gonna be performing the NGT insertion. So for the assessment, doctor's order, client's level of consciousness and level of knowledge and understanding, availability and functionality of the needed materials, check for history of nasal surgery or deviated septum, assess patency of nares, determine presence of gag reflex, assess mental status or ability to participate in the procedure. For the planning, before inserting a nasogastric tube, determine the size of tube to be inserted and whether the tube is to be attached to suction. For the equipments, prepare equipments, large or small bore tube, non-latex preferred, non-allergenic adhesive tape 2.5 cm or 1 inch wide, clean gloves, water-soluble lubricant, facial tissues, glass of water and drinking straw, 20 to 50 ml syringe with an adapter, basin, pH test strip or meter, bilirubin dipstick, stethoscope, disposable pad or towel, clamp or plug optional, antler flux valve for air vent if Salem-Sam tube is used, suction apparatus, safety pin and elastic band, and CO2 detector optional. For implementation, introduce self and verify the client's identity using agency protocol, explain to the client what you're going to do, assist the client to a high Fowler's position if his or her health condition permits, and support the head on a pillow, place a towel or disposable pad across the chest, perform hand hygiene and observe appropriate infection control procedures, example, clean gloves, provide for client privacy, assess the client's nares, prepare the tube, support the patient during the procedure. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe and then from the tip of the earlobe to the tip of the xiphoid. Mark this length with adhesive tape if the tube does not have markings. Insert the tube. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Insert the tube with its natural curve toward the client into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube toward the nasopharynx. If the client gags, stop passing the tube momentarily, have the client rest, take a few breaths and take sips of water to calm the gag reflex. Ascertain correct placement of the tube, aspirate stomach contents and check the pH which should be acidic. Confirmed by X-ray, place a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube while listening for a whooshing sound. Secure the tube by taping it to the bridge of the client's nose. Lastly, for evaluation, evaluate the patient's response to the procedure. Document the procedure and other important data on the client's chart.
Good day, ma'am. I'm Jirah Sarmiento, student nurse from Nasogastric University of Science and Technology. Ano pong pangalan nyo?
Ako po si Eliza.
Okay po. So ngayon po, magpe-perform po ako ng nasogastric tube insertion. Doon po natin papadaanin yung food and medicine nyo simula po sa tip ng nose hanggang sa stomach.
Okay po.
Talaga?
Po natin yung leg na